This video will cover how to access the episode of care that we created in the first video. You can do so from the chart face. If you have not set up for UB04 or institutional billing, please see our first video. To access the episode of care that we just created, you can do so from the chart face. This is in the lower right hand corner where it says EOC for episode of care / UB04, or you can do so in the chart room. This option is located under the patient accounts file cabinet and it says EOC / UB04 in blue. Simply click on it to access it. Now we want to pull up that specific episode of care for the patient that we were working on. So we're going to click search, and it actually has in the last start date and discharge date and the last patient that we entered. So we can click search there. And there's Hallie Timber. We're going to click on her name. Then we're going to go over to the far right hand column and click create or update UB04 from the selected episode of care. This will generate the UB04 that we can edit and add additional charges to. Had we created any notes within the chart after the dates had been set in the demographics, you would see a list of those encounters and notes listed in the second column, and you would also see any related charges if they had put in billing codes in the third column. If you do not want those charges included on your UB04, you'll have the opportunity to remove them. For now, let's click the edit pencil to access the work areas of the UB04. The work areas are laid out in the box format so that you can see what field relates to what box on the paper claim. Keep in mind that just because the information is in a specific box here in this area, that it may have a different relation on the electronic format of the 837I, which stands for institutional. Here I can see in box 1, I have my facility, box 2, my billing facility, box 3, my patient control number, and you'll see box 4 is blank and blue. Blue means that it is a required value. So I need to enter in the type of bill. Here I'll enter in 0732 because this is the first claim that I'm submitting for this person, but they are still a patient. This is an outpatient facility and it's for IOP. You can find a list of the different types of bills on the CMS website. Now that I put in my type of bill, I'm going to come down here below. I can see patient name is in box 8. I can see the address. I can see the date of birth, the sex, the date of service, that they were first admitted, the hour, and then box 14, 15, and 17 are blue, which means they're required. In box 14, I'm going to click into it and it'll give me a drop-down list with various related numbers. Here is the type of treatment that this is. Was it emergency, urgent, elective? I'm going to say 9 because it's not available to me. And then box number 15 is how was this service sent to me? Was it a referral, such as from a physician or clinic, or were they transferred from another facility, or even 1013 from a local law enforcement? Here I'm going to actually say this was a clinic referral. We do not have a discharge hour because they're still a client. So under number 17 for the status, I'm going to click in the field and I'm going to select number 30 that they're still a patient. There are other fields that you can document down below. However, in this area, the program's populated all that I need for my particular billing example. So I'm going to click over to the Services tab. And in this area, I'm actually going to create the services manually. So I'm going to add service. I can access the patient demographics if I just need to take a peek at it. Maybe I have some notes in there that I need to look at. Otherwise, here under number 42 revenue code, I can click in the field and see a list of those revenue codes. And I'll select my 0905 IOP daily. And I'll just update my IOP setting. And you can see the description is there as promised, the clinician who is the attending provider, the HCPC code, which if you do have multiple HCPC codes or CPT codes linked to that one revenue code, you can select from the drop-down list. the number of units or days, which is 1, total charge is 400, and then here's the date of service, which you can adjust as needed. Here I'll say on the second, and done. That will populate service line number 1. And you can continue to add these as necessary. If you are billing for inpatient or residential and you're billing for a week at a time, you can put multiple units or days. You do not have to put one for each individual day. This is specific to IOP, that you may have one day and then skip a day and then they come in the next day. And I'll just reiterate this so that you can see what it looks like. Maybe they came on the 3rd, but they didn't come on the 4th. They came on the 5th. And then done. I'll fill out the rest of these really quickly. So now that I have a list of my services and I can see my total charges, I'm going to move on to the coverage tab. In this area, you'll see a list of the different payers, and I have it so that it includes the payer ID here, your health plan ID, release of information, the assignment of benefits, and then down below you can see the insured, the patient relation, and the insured's unique ID. There are ANSI options to maneuver some of this data into different fields if you're printing out the UB04 form. However, if you're sending them electronically, these will all link up to the appropriate loops and segments in the ANSI options that are going to be in the true 837I ANSI fields. Okay. We're going to move on to the other codes tab. You can see here, there's your authorization code, January 2018. And then number 6, it does have the DX qualifier as ICD-10. And then in box 67, you can see the principal diagnosis. It has the code in there. If you did not enter in a note, the details may not be populated in here and you may have to enter them manually. These fields allow the opportunity for free text, and the DX qualifier does come with a drop-down menu. There are also some payers that require a present on admission indicator, which is your POA indicator. And you'll want to make sure that you have the ANSI option turned on in settings and directories for that payer. Just click on the drop down and select it there. For inpatient or residential, it may require you to have a admitting diagnosis under box 69. That will be right there, and you can click in the field if you needed to free text that in as well. Then down below is for your attending. You can see the NPI number, last name, first name. Remember that that information is pulling from the demographics. And that is the majority of the various fields that you can fill out here in the UB04 billing. There are other items in here that you can populate as well if you need to, such as box 81A, 81B, 81C. However, for this example, it's not a requirement for my IOP billing. So what I'm going to do is I'm going to click the back button now that I'm done. This will take us to the Batch UB04 tab, where you can submit claims electronically from here, as long as you're set up with an integrated clearinghouse and you have the institutional payer IDs. Here I can see Hallie Timber, start date, end date. I can edit this if I want. I can print it out. And it will ask me, do I want to print it out on an actual UBO form, such as I have the red form and I have it in the printer and I just needed to print the text, or I can print it on blank paper. Well, it'll print like the whole front of the form. It does not print the back of the form. So this is really helpful if you need to submit it via fax, or if you need to have to scan it into a portal. They usually don't care if you have the back of the form because it's always the same. You can also look at the ANSI options, so you can view those details if you're familiar with what that should look like. And also, if you have any errors, our program will give you this red light to let you know that you do have errors and that you need to stop and fix those. And you can click on it and it'll tell you what is missing. Insurance information is missing. The social is required for Medicare. So from here, I can actually click the edit pencil and I can take a look and see if I have their social in here, which I know I do, but something that actually occurred is in the demographics, I didn't update it on my payer. So you can go back to the demographics from this screen, click on insurance information, and I can see that there's no social. So I will copy from patient info to update that since I put it in after the fact, and then click continue. Now I can go back to my episode of care to update that, create or update. All my services are there, and I can click the edit pencil just to confirm I'm not missing anything else, and then go back. Now that I've corrected it, I can see that the error is gone and this claim is ready for transmission. I've already have it selected, as the program will automatically select it when it's ready to go, and then you can click Submit Selected. If you need to send more than just this one claim, whether it's for the same client or a different one, you can return to the episode of care and continue on through the process until you have a batch of these and send all of them at once. For now, I'm just going to click Submit Selected. I've got a confirmation that this has been queued for transmission to the clearinghouse, and give it at least a minute to get there, like a literal 60 seconds. We're going to click OK. It's going to say sending, and as soon as delivered, it'll turn green to delivered. If you want to see what you've sent in the past, you can look at your claim batch log, and there's a history of the different claims. You can show them. As you can see, I submitted one for Noel Nation earlier today. And that is how you submit the UB04s or the 837I for institutional billing in ICANotes. Thanks and have a great day.